Now, Rebecca, that's not exactly all that happened in Nova Scotia politics today. This morning, the Auditor General, Jacques Lapointe, took on a couple of provincial government departments in his latest report. From health to education, he had some pretty harsh words.
Oh, he sure did, Ron. The Auditor General released 77 recommendations to government today in a 140-page report. But whether any of the recommendations will be followed through is the main question.
Alarming could be a word used to describe findings in the latest AG report. Among the discoveries, poor infection prevention and control at Cape Breton hospitals. Early last year, there was an outbreak of C. difficile. Then in December, another outbreak where 2 of the patients died. Jacques Lapointe discovered issues with the reuse of internal gastro, broncho and colon scopes. In 2 cases, there is no evidence the scopes were ever cleaned or disinfected before reuse. That has to change.
I don't care who's in charge. They just have to do the right thing.
The health minister says many improvements have already been made since the initial outbreak.
We are working very hard with the Cape Breton District Health Authority to change the culture of infection control and prevention. And, we take this very seriously and we'll continue to work hard on improving the procedures.
The report also touched on prescription drug abuse. It found inadequate monitoring was allowing abuse to go undetected.
They're trying to track people misusing the prescription system. Then you need to have very current information. If someone is, for instance, using a stolen prescription pad, he'll be doing this now, repeatedly. So you need to know, and you need to know from the first whether it's happening.
Amy Graves' brother Joshua died after using prescription drugs at a house party last March. Since then, she has become an advocate trying to stop prescription drug abuse in the Annapolis Valley. While she applauds today's recommendations, action is what she'd really like to see.
Some things that really stood out to me were that prescription monitoring program is constantly getting these red flags and they're not following up on it. There's no, they're not following up on anything, it seems. So what is the point of having a program, putting all this money into it, having this technology, and nobody's using it, nobody's following up, no one's sending warning letters, notification letters to prescribers.
Now, to bring us back to the question of whether the recommendations will actually be followed, government doesn't have a very good track record. Lapointe says only 63% of recommendations in the 2005 to 2009 reports were implemented, a number he calls inadequate. The worst offender is the Education Department. The AG says there was very little cooperation from the department when his staff tried to get information and data. At 13%, education came in last when it comes to implementation.